Hello again. Welcome to my YouTube channel. I would like to thank all the subscribers who have been watching my videos. One of the subscribers actually asked me to talk about my concept on obesity as a prelude to concepts on whether there are fad diets or there are certain lifestyle interventions that we can do and what to expect from these lifestyles and dietary interventions in terms of weight loss. So for this afternoon, I'm going to discuss with you some deadly facts that you need to know before embarking on weight loss with regard to obesity. We all know that when we talk about being overweight and obese, you have to determine at first whether your weight is over that based on your height, meaning being overweight and obese depends on what you're weighing now compared to your height. So the easiest way to determine if a person is overweight or obese is by measuring the so-called body mass index. It can actually easily be calculated in an app in your iPhone or any smartphones. And basically, it tells you one thing. It tells you that if your present weight is a healthy weight, if you're overweight, or if you are obese. And this is what we call as a body mass index. So remember, Asians has a different cut-off in terms of being categorized as overweight versus obese or versus normal. It's a number that you get. And what is important is the greater your BMI, the greater the number that you have, the greater is your risk of health problems from being overweight and obese. What is important is if you know that you are overweight, then at least you have to do certain measures first to avoid gaining more weight because it can help lower your chances of developing health problems later. We know that obesity is now categorized as a chronic disease. It is the same level as diabetes. It's the same category as hypertension. Meaning, since it's a chronic disease, it requires a chronic treatment. It is not like an infection where you take something for a week and the disease is cured. As a result, it takes time for obesity to be addressed or to be solved. And as a result, a lot of our patients suffer from the complications of this disease. For me, the most obvious and the most difficult is the mechanical problem. Because of severe overweight, the patients develop severe arthritis. It's a wear and tear of your joints, and therefore every movement that you do at a certain period of your life will entail pain. And therefore, arthritis is inflammation of the joints because the joint cannot handle too much weight. What's also very important, you may not realize it, that sleep is also affected by being overweight because you suffer from what we call as an obstructive sleep apnea. You can ask your doctor what is obstructive sleep apnea and if you're suffering from it. But what's important, chronically long-term, that will present with long-term complications would be the metabolic complications of being overweight. First, it has been shown to be the culprit in why a patient with a genetic risk of developing diabetes will develop diabetes. It's your lifestyle and it's your habit in terms of eating that predispose you to develop this disease. As we said, any excess carbohydrates that you take in is converted into fat and therefore deposited as fat in the liver. That's why you also suffer from what we call as a fatty liver. Once you have fatty liver, it's basically a red flag for you for you to develop the so-called diabetes as part of the so-called metabolic syndrome. But what's also very critical that a lot of patients don't know is that being overweight and obese have mental issues. You develop depression, you develop anxiety, and more so because of the so-called body image dysphoria. So how come you became overweight and obese? It's not simply your fault. It's a complex disease. It involves a lot of neural systems, nervous system entanglement that resulted in you developing obesity. But overall, the brain by default is actually turned on to eat all the time. And you have to understand that because once you are overweight and obese, because you give in to the cravings of or the hunger and the craving, a lot of our patients who are overweight and obese tried to lose weight. In an attempt to lose weight, they always fail. And therefore, based on this data, most patients who are overweight and obese had a mean of 4 attempts of trying to lose weight but always fail. Why? Because they don't understand the basic concept of obesity. Once you start losing weight, you are using a certain fad diet. Of course, you lose weight right away. But again, this is how your body defends weight loss. It tries to fight weight loss incredibly hard because the body feels that you are sick. When you start losing weight, the body tries to conserve energy so that for every 1 kilo weight loss, the body lowers your metabolic rate by burning lesser calories. On top of it, the body defends by increasing hunger hormones so that it will increase your appetite by 100 calories per day. And this is for this reason that a lot of patients will fail because they don't understand that the body is trying to defend weight loss and therefore you achieve a plateau. If you're on a fad diet where you almost don't eat per day and yet you are no longer losing weight, then that's where you try to eat again because you get discouraged. Why is it that I'm not losing any more weight? So obesity, if you understand it as a chronic disease, requires a lot of other interventions aside from diet and lifestyle. Just like diabetes, just like hypertension, in spite of lifestyle change, most of our patients will eventually require pharmacotherapy. In fact, in obesity, some of our patients will eventually resort to bariatric surgery. But you have to understand this. If you're on diet and lifestyle alone, if you are 100 pounds overweight and you want 50% of that overweight to go away, diet and lifestyle unfortunately can't do it. Why? Because at most, diet and lifestyle can only make you lose 5 to 10%. Again, because of the body's way to defend weight loss. Almost always, you may need pharmacotherapy. If you're morbidly obese, you may need bariatric surgery. But the 5 to 10% weight loss that you achieve from dietary intervention is not bad at all because it provides you healthy benefits in terms of metabolic parameters. Studies have shown that 5 to 10% weight loss can result in the prevention of diabetes, can prevent infertility from PCOS, it can improve lipids, it can prevent asthma, and of course, it can remove the excess fat from your fatty liver. However, if you have to be on a lifestyle intervention, you have to go on with it long term. Treatment of obesity requires chronic intervention. You cannot just do a fad diet for 6 months and expect that weight loss to be maintained long term. That lifestyle intervention, that behavioral modification should continue. Among those patients who will need pharmacotherapy, just like treatment for diabetes, just like treatment for hypertension, you have to continue on that treatment to achieve your goal weight loss. Because once you stop the drug, this is where you get the weight regain. Bottom line is, you have to understand that obesity is a chronic disease. It requires early intervention because you want that present weight to be now your steady weight. You don't want to gain more weight because it will now be more difficult for you to lose weight. Your initial goal when you try to make yourself for lose weight loss is just to prevent further weight gain. Your initial goal is just to avoid the complications of being overweight. And that whatever approach in terms of lifestyle, whether you're on medications, you have to remember that obesity is a chronic disease and therefore requires a long-term, lifelong commitment. So understanding obesity for me is key if you want a long-term successful goal in weight management. So if you like my videos, please click subscribe and the notification bell to be notified for new videos. Please feel free to wait for my next video. I'll be talking about ketogenic diet, whether it's a good way of losing weight. And I would like to thank again my subscribers for this topic, and feel free to email me or to write to me in the YouTube channel for whatever topics you think you would like to hear from this video. Again, click on some of the links regarding lifestyle intervention as well as intermittent fasting that we discussed in the previous videos. With that, thank you very much.